What the study says.
Should I shave pubic hair or not? It's a question, well, many of us have probably pondered, maybe quietly. But today, we're really digging into the science behind it. Welcome back to What the Study Says. I'm Dr. Kai.
And I'm Dr. May.
And today, our deep dive explores the sometimes surprising health side of pubic hair removal.
Exactly. We're looking at everything from, common complications to potential links with STIs, even UTIs. We'll draw on recent studies to help you make really informed choices.
Okay, so first off, just how common is this? Because it feels pretty widespread.
Oh, it absolutely is. We're talking huge numbers. 84% of women in the U.S. report some kind of removal.
84%. Wow.
Yeah, and about 66% of U.S. men. And then you look at somewhere like Saudi Arabia, and it's virtually all women.
All of them.
Pretty much. And often starting quite young, too. The average age noted in one study for Saudi women was around 13 and a half.
13. So right at the start of adolescence.
Exactly. And the reasons people give are varied. Hygiene comes up a lot, aesthetics, sexual appeal.
Partner preference, too, I imagine.
That's a big one. And in some places, there's definitely a societal or even religious pressure involved for pubic and underarm hair specifically.
Right. But it's not always smooth sailing, is it? What does the science say about, well, complications?
No, definitely not always smooth. Complications are actually incredibly common, much more than people might think.
How common are we talking?
Well, one study with Saudi women found 75.5% reported at least one issue.
3/4 of them.
Mm-hmm. And in the U.S., a study showed 60% of women groomers experience something, usually minor things like skin cuts, really bad itching, ingrown hairs, rashes, sometimes burns from waxing, maybe.
Okay, minor, but still not pleasant. Does it ever get more serious?
It can, yeah. While most are minor, a noticeable chunk of people actually need medical help. That same Saudi study, 17.9% sought treatment.
Nearly 1 in 5.
Right. And in the U.S., looking at emergency room data between 2002 and 2010, visits for grooming-related injuries, specifically genitourinary ones, they increased 5-fold.
5 times higher. Mostly from what? Razors.
Mostly razors, yeah. And waxing injuries, too. It just shows that what seems like a simple routine, well, it carries a real risk of injury that sometimes needs a doctor.
And you mentioned something about risk factors, like weight.
Ah, yes. That was interesting. The data suggested women who are overweight or obese have nearly double the risk of complications.
Double. Any idea why?
The thinking is it might just be harder to see the area properly, leading to more accidents.
Makes sense. Okay, so beyond cuts and irritation, what about bigger health concerns? You mentioned STIs earlier. Is there a link?
That's where things get a bit complicated. Some early studies, the ones using self-reported data, did show a positive link.
Self-reported meaning people just said if they'd had an STI.
Exactly. And the correlation seems strongest for STIs that affect the skin, like herpes or HPV. The hypothesis, was that grooming creates tiny micro tears in the skin.
Making it easier for pathogens to get in.
Precisely. That was the theory. But then newer studies came along using laboratory-confirmed diagnoses.
So actual test results.
Right. And those often found no general association between grooming and some common STIs like chlamydia or gonorrhea.
Huh. Okay, so the method really matters here. Lab results tell a different story, at least generally.
They do. It highlights how important it is to look at how the data was collected. But that doesn't mean there are no links found. There are some specific, more nuanced findings.
Okay, like what?
Well, for example, one study found that anal grooming specifically was linked to a 3 times higher risk of rectal STIs among gay and bisexual men.
Okay, so location matters.
It seems so. And frequency might matter, too. Removing all pubic hair very frequently, like more than 6 times a year, was associated with a higher prevalence of some genital STIs in women.
More frequent total removal seems riskier then.
Potentially, yes. Although, interestingly, for something like pubic lice, being extremely groomed might actually be protective. Sort of gets rid of their habitat,
Right. No hair, no home for lice. Makes sense.
Yeah.
Any other specific links?
There was also a concerning correlation noted between razor shaving, especially complete removal, or shaving the labia majora, the outer lips, and issues like vulvar inflammation, dysplasia, which is abnormal cell changes.
Dysplasia, that sounds serious.
It can be a precursor, yes, and potentially even a link, though maybe less direct, to vulvar cancer.
Wow. Okay, so the risks really range from minor irritation all the way to potentially very serious conditions. That's sobering.
It is. It suggests we need to think about these practices a bit more critically.
And you also threw in something totally unexpected earlier: UTIs, urinary tract infections. How on earth does pubic hair removal connect to that?
Yeah, that was a surprising finding from recent research. It
Yeah.
found that extreme removal, like removing all the hair at least once a week.
Okay, very frequent.
Very frequent, yes. It wasn't linked to just getting a UTI in general, but it was associated with a threefold higher risk of getting recurrent UTIs.
Recurrent, meaning multiple times.
Exactly. 3 or more UTIs within a year.
3 times the risk. That's significant. What's the proposed reason?
It's fascinating, actually. The theory is that pubic hair might act as a sort of a natural protective niche.
A niche, like for good bacteria.
Precisely. It might help host beneficial bacteria, like lactobacillus species, which are known to inhibit E. coli, and E. coli is the most common cause of UTIs.
So the hair itself, or the environment it creates, could be actively helping prevent infections, like a little microbial shield.
That's the idea. Or maybe the hair itself has some antimicrobial properties. It suggests our bodies have these, built-in defenses we might be removing without realizing it.
It really makes you think what society might push as clean or attractive could actually be interfering with natural protection mechanisms.
It does raise that question, doesn't it?
So pulling this all together for you, our listener, it seems pubic hair removal is very much a personal choice, but it's definitely not just about looks. The science suggests there are real health factors to consider.
Absolutely. From common injuries to these more complex potential links with STIs and even recurrent UTIs.
It leaves us with a thought, perhaps. When we make grooming choices, are we really thinking about what serves our health best? Or are we maybe just following trends or unspoken rules without considering the biological side?
Something to ponder, for sure. We hope this deep dive gives you some useful science to consider for your own decisions.
Definitely. If you found this conversation helpful or interesting, please do subscribe to What the Study Says, and maybe share it with friends and family who might also find it useful.